Hello everyone, this is Babak. Welcome to OET with Babak.
In this video we are going to talk about OET speaking communication criteria. So if you remember, it was linguistic and communication criteria, now communication criteria. As you can see, there are 5 criteria in the communication criteria, and each of them is marked on a scale of 0 to 3, and that is 5 marks in total. And it's supposed to more explicitly measure the communication skills that you are supposed to demonstrate during the exam. The first criterion in the communication criteria is building relationship. It means initiating the interaction appropriately, like greeting the patient, introducing yourself, and talking about the nature of the interview, and to establish rapport. But rapport basically means the connection with the patient. It means connecting with the patient. You need to demonstrate an attentive and respectful attitude, which we will discuss later. You need to establish trust and make patient comfortable, ask for permission or consent, and to be sensitive to embarrassing matters if there are any. You also need to adopt a non-judgmental approach. It means that you accept patients' views and acknowledge the legitimacy of the patient to have their views or feelings, even if it might sound unreasonable or silly to you. So sometimes I've heard students saying, there was a patient who was saying that there is something wrong with my toe, and so it might sound something trivial or unimportant, but it is important to the patient. And even if this task sounds or looks silly to you, this is just a test to make sure that you take the patient seriously. Also, you need to show empathy for feelings, predicaments, and emotional state of the patient. It means to understand the patient, communicate that you understand the patient, to tell them that you understand them, and you also use verbal or non-verbal cues. So basically to give the patient reassurance that you're taking them seriously and you are listening to them. Well, the next criterion is understanding and incorporating the patient's perspective. It means to explore their ideas and concerns and expectations. We call it ICE. In short, it's ICE, ideas, concerns, expectations, to find out the patient's perspective of illness or the concerns. Basically find out what the patient thinks about the problem, or what they are concerned with or worried about, and what they are expecting to achieve in this consultation. And you have to show that you're asking directly or encouraging elaboration of the patient with you. Also, you need to pick up patient's cues. And what is a cue? This is very important. Any hesitation, any pause, any change in volume or tone of the patient, basically it could be a cue. Also, we have some non-verbal cues. It means the way the patient is sitting. If they, for example, sit crossing arms, or if they don't keep their eye contact with you, or if they don't maintain a connection with you, if they are avoiding you, or if they are hesitating to answer your questions. These are all cues. Also, you need to show that you echo patients' concerns, and to tell them that you understand what their concern is, and then to encourage them to carry on and to explain more, and to participate in the consultation. and to basically relate the explanations that you are giving later to the patient relevant to the ideas and concerns and expectations that you have elicited in the first part of the consultation. So basically later on you're going to explain and give some information to the patient. You need to keep these in mind, that what patient's ideas were, what their concerns were, and what their expectations were. And therefore when you say that when you later explain to the patient, you say that you have listened to the ideas, concerns, expectations. An example is given here in this slide, which says you mentioned earlier that you were concerned that you might have angina. I can see why you might have thought, but I don't think this is angina, for example. So this sentence says that, well, I remember you said this, I understand that you're concerned with angina, I've checked everything, and I understand what you might be, why you might be concerned with this, but now I can reassure you that this is not the case. Our next criterion in the communication criteria is providing structure. And basically this means that you have to sequence the interview purposefully and logically. And this helps efficient data gathering and data giving. So you need to balance this with a patient-centered approach. So in other words, if you talk too much, or if you're the person who's talking all the time, that wouldn't be a patient-centered approach. But if you allow the patient to express themselves and to talk about their ideas, concerns, expectations, that would be more like a patient-centered approach. So basically you have to balance it here. But in OET exam, in fact, it's not the patient who needs to speak too much. It is you, as the person who's doing the consultation, need to manage it basically, and manage the time, or you will lose the time, because if you keep quiet, if you ask too many questions and allow the patient to speak, then you wouldn't be able to score very high. Signposting is something which is very important. Basically it means that whenever you want to change the topic or change the part of the consultation, you just give the patient an idea, you just sign this and you just show that. Basically letting the patient know where the interview is going and why. For example, to say, okay, now let's talk about your treatment. Or you just say, okay, that's what I remember. You said that you had chest pain, or you had difficulty breathing, but it was temporary. It wasn't related to exertion or to exercise. And I think we need to examine you. So when you say this means that this is a signpost. You're saying that, okay, we're finished with the history, now I'm going to examine you. Also, for example, you say, okay, I don't think this is angina, so what we can do for treatment is this and that, for example, to send a blood test, or to ask for an ECG, or just to wait and see how it goes, or to give the patient different options. So that would be signposting. So it is basically the way we progress from one section to another section of the consultation, and then we explain the reason. Another way of giving organization is using organizing techniques in explanation, such as categorization. It means you talk about the categories you're going to talk about later, or labeling, which means important points. It means emphasize the important points in the consultation. So you say it is important that you realize you realize the importance of lifestyle change, for example. Chunking means to create clear gaps in information categories. So it is to give the information to the patient in small chunks and do not lecture them. Basically, tell the patient something about the illness. You say, I don't think it is angina because of it's not being related to exertion, and because it's been temporary, because you don't have any risk factors, and because basically you don't have a typical chest pain, for example. And then you ask the patient, could you understand me, or is that something that answers your question, or basically checking patient's understanding or acceptance. And then repetition and summary, it means that at times you need to repeat the information or summarize, or you summarize what the patient said and then repeat what the patient said. So this is a way of providing and creating structure, and we will talk about summarizing more later. The next criterion is information gathering, basically, by the candidate. It means facilitating the patient's narrative by active listening and minimal interruption. You need to use silence and pausing properly whenever it is necessary. You wait for the patient to talk, and at times you pause. Verbal encouragement, say I see, okay. And echoing and repetition, it means to say the last word that the patient says, or to repeat what they say. For example, the patient says, yeah, I was just having this problem yesterday, and it's all right, yesterday, okay. And then the patient says, well, but this morning I was also experiencing some trouble, and so, right, okay, this morning too, okay. So this way you're actually encouraging the patient to talk. Paraphrasing and interpretation. Sometimes you need to paraphrase, you need to ask for correction or for clarification, and say, well, so you mean that you had this problem yesterday and this morning as well? And they say, the patient says, yes, that's right. Using open questions first, which means WH questions. It means like when did the problem start, and how did it start, and what was it like? Was it severe? Was it abrupt? Or did that start slowly? Okay, but yeah, at first I used WH questions. I said, well, what was it like? How long did it take, or how long did it last? What was it like in terms of severity? And later I switched to close-ended questions, like, okay, did that start suddenly, or did that come up little by little? Was it related to anything else? Did you have any other symptoms with it? Did you have any sweating? Did you have any basically dizziness or feeling faint? And these are usually the questions that we have to check, and if the patient doesn't volunteer to tell us, so we need to check these anyway. And also we actually shouldn't use leading questions or combined questions or compound questions. It means not to ask 3 questions at the same time, so the patient gets confused and are not sure which one to answer, or maybe some of the answers might contradict each other. So also, if you don't understand something, if you're not sure, then you ask for clarification and you say, may I ask what you mean by saying I had this problem before, but didn't realize it's so serious. Or when you say something, when you say for example difficulty breathing, do you mean you could not breathe, or do you think that you had a feeling? Or for example something like dizziness, you say, well, when you say dizziness, did you really feel the room is rotating around your head, or did you feel that you're just lightheaded? And summarizing information to encourage correction and invite further information. Summarizing is very important. We will talk about this later. I might actually give you a sample consultation to then realize how summarizing could be helpful. Basically, what summarizing does, it gives you some time to think. It gives you the whole picture. You sum up before you carry on. It helps you realize that you're missing some information and you need to ask that. Ensures accuracy of the information, so facilitates more information. Basically, you check with the patient, well, you see this and that, and in summary this is all that happened. And the patient can say, yes, that's right, and I forgot to add or I forgot to say this as well. So they can add to the information, or they could say, well, actually not yesterday but today. So they can correct you if you remember something wrongly. And to start summarizing, you can use sentences like this. Okay, let me see what I remember, or what I remember is this, or can I just see if I've got this right? You said this and that, and is that correct? And the patient says, yes, it is correct, or it is not. Okay, and then the next criterion is giving information to the patient. So basically we establish what the patient already is concerned with, if they have any ideas, and then when we are going to give them information, it makes sense that you actually ask them, what do you think it is, or what do you know about this problem, and basically to assess their prior knowledge, and then determine what information to give them and how to give it. So you need to basically decide how much basic you have to talk, and if your patient is a well-educated person, you probably would not need to go too basic, and it might sound foolish to for example, to explain to a well-educated person what something like chest pain could be. And also you need to pause periodically when giving information, as we said, to give the information in chunks, and using a response from the patient to guide the next step. We call this chunking and checking. It means give some information and check with the patient if they understand this, and decide what we have to add to our conversation. It is not recommended to use does it make sense, or do you understand this? Not like this. It is a little bit offensive, so it's better to be avoided. So in simpler words, we have to encourage the patient to contribute, and we need to check their reactions and their feelings. We allow them to ask questions and to express doubt if they don't agree with us. If they want to seek clarification, then we can discuss that. We need to allow that, and we have to actively encourage questioning during the information giving, and you need to keep saying, okay, do you have any questions, or is there anything you would like to know, is there anything else you would like to know? And to check the patient has understood the information. So again, I say, don't say, does it make sense? Well, if you ask someone, does it make sense, they say, yeah, it makes sense, because if it doesn't make sense, it means that I am foolish, or I'm stupid. So you can say, I know this is a lot to take in, so it might not be very clear, but would you mind repeating back to me what I've just said, to make sure we're on the same page, or we're in the same boat? Or sometimes you can say, well, I know it's too much information to take in, but would you mind repeating what I just said, just to make sure that everything is clear between us? So basically that is the way of asking for a repetition. I know it could be awkward anyway. Well, in simple words, there is more emphasis on the communication skills, and therefore less focus on linguistic skills, although there is still emphasis on both, but you need to clearly show better communication skills during the test.